Good afternoon, and welcome to today's webinar, NC Rural Health Transformation Program, Progress Update and Roots Hub Introductions. Before we get started, here are just a few reminders about the webinar technology. Please make sure that you are using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure that your microphone is muted for the duration of the call. Questions can be submitted at any time during the presentation using the Q&A function on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. American Sign Language interpreters for today are Amanda and Jacob. For closed captioning, select the closed caption feature on your dashboard. To adjust the video layout and screen view, select the View feature located on the top right-hand corner of your screen and choose the view that works best for you. This webinar will be recorded and made available after our event. Today's agenda topics include welcome, opening remarks, NCDHHS updates, presentations from each of our Roots Hubs leads, and a Q&A session. At this time, I would like to turn it over to Deputy Secretary Farrington.
Good afternoon. Thank you all for joining this afternoon's webinar on the Rural Health Transformation Program. We're delighted that you've been able to join us, and we appreciate your participation. As many of you know, we've been implementing the Rural Health Transformation Program for a number of months now. And we've achieved a great amount of progress, and that's due in part to the input and partnership that we have with you as community members. We really appreciate your input and your interest in rural health transformation, and we're happy today to be able to share some update information with you. I am happy to share with you that we have a list of distinguished guests who will be able to provide information to you, and you'll get to learn more about where we are in our progress towards implementing the program. I'm grateful that Secretary Devduta Sangvi can join us this afternoon. As Secretary of the Department of Health and Human Services, Secretary Sangvi has over the last 18 months helped our department make great strides towards creating a healthier North Carolina. From implementing the life-changing medical debt relief program to introducing the first of its kind child and family specialty plan, to ensuring that those served by the child welfare system can access care, Secretary Sangvi is laser focused on creating a North Carolina where every person can access quality and affordable care when and where they need it most. We're happy for his participation today, and now I will pass it on to Secretary Sangvi.
Thank you, Deputy Secretary Farrington, and thank you to everyone participating on this webinar. As I see some of the names popping up, I see a lot of familiar names, familiar because I know many of you have been following this process almost for a year now since we first learned that the RHTP was proposed and North Carolina was going to submit an application and so forth. I see many of you were part of the 400 plus individuals who gave us counsel and guidance on how to move forward. And today's really a special day. Today's the day to introduce you to what's really the anchor, the most important first step that we need to take to get to go on the Rural Health Transformation Project and its introduction of the Roots Hubs. I'm not going to spend a lot of time talking about the rural imperative in North Carolina. You all know how important it is with the number of people in North Carolina who live in rural communities, the hospitals that are at risk, and how important it is to identify illness and disease early, particularly in our most vulnerable communities. And that's what the Roots Hubs are going to do through needs assessments and other processes that are really designed to understand what our communities need. Each hub is now starting the process of establishing their own governance, conducting regional needs assessments, and eventually onboarding a diverse network of partners like many of you. You will help us drive community-led solutions to improve health. Our hubs are vital to reaching our goal of transforming rural health because they're really based in their communities and understand the unique needs. Again, one of the most important things we wanted to make sure is We're making decisions for the rural communities, by the rural communities, not out of Raleigh or any other part of the state specifically. As our hubs begin to receive resources to build foundational infrastructure and launch priority programs such as chronic disease prevention, nutrition access, perinatal health, and workforce initiatives, it's my priority to keep our efforts person-centered so that every North Carolinian can tangibly benefit from our work. We all know that in order for the non-rural communities to thrive, we need the rural communities to thrive and vice versa. I want to again thank each of you for attending this webinar and for your engagement in the North Carolina Rural Health Transformation Project. I hope that you're encouraged to get involved with your hubs and look for additional opportunities to help the agency transform rural health in North Carolina. I want to take a moment and say thank you to all the Roots Hubs for their ongoing work, as they're vital to the long-term success and sustainability of this program. As you know, our plan is to be able to transform health with a pretty short time period. We wanted to have significant, meaningful, sustainable change in 5 years, and it's really going to require a stable core of Roots Hubs and a large number of community organizations helping them achieve their goals. I'm eager to get started as we create a healthier North Carolina for 11 million people. And so again, thank you, everyone. Welcome to the webinar, and I'll turn things over back to Deputy Secretary Farrington.
Thank you, Secretary. We appreciate your remarks, and we are terribly delighted to have our Roots Hub partners with us today. Let me start, though, by introducing you to Maggie Woods, who is the director of our North Carolina Rural Health Transformation Program. Maggie brings a wealth of knowledge of rural systems and is a great leader who's committed to supporting our communities. Maggie comes to us from a background of public service, having previously served as the director of the North Carolina Department of Information Technology's Office of Digital Opportunity. Maggie led efforts at that office to close the state's digital divide, enabling North Carolinians to benefit from online resources and services through access to the necessary technology and digital skills. Maggie grew up in rural America, and she understands firsthand many of the healthcare challenges that our rural communities face. This program represents a terrific opportunity for Maggie to lead us to strengthening our health systems, expanding care and access, and making sure that everyone across our state has the opportunity to achieve their best health. So we're terribly delighted to have Maggie here in one of maybe her first webinars in her new role. So Maggie, we'll turn it over to you now.
Thank you so much, and good afternoon, everyone. I'm so excited to be here. As Deputy Secretary Farrington said, I'm brand new to the program, but I'm not brand new to working in communities across North Carolina. So as I look on who's here today, I know I've worked with many of you. I look forward to continuing to work with you over the course of the next 5 years. And for those of you I don't know, I look forward to connecting with you and working with you in the future. So today I'm going to start with an overview of rural health transformation. I know that many of you have already been involved in this program pretty significantly, but for those of you who might be new, I think it's always good to level set. And then I'm going to talk through some of our accomplishments and what we expect to achieve over the next 6 months. And then I have the absolute best job, which is to introduce you to the Roots Hubs leads, and you'll have a chance to hear from them. So I'll start, but then we'll hear directly from them. So if you see on this slide, you know, the funding for the Rural Health Transformation Program is designed to address long-standing challenges in rural healthcare, including workforce shortages, hospital sustainability, gaps in access to mental health and primary care services, and access to and training of technology for both providers and patients alike. And if you move to the next slide, we have a little bit of rural health transformation by the numbers. So on the next slide, there we go. Really the goal of rural health transformation is to ensure that every North Carolinian benefits from improved access to healthcare and modernized care delivery. As the Secretary said, North Carolina has a very large rural population, right? We have the second largest rural population in the United States. And rural health care transformation is an expected $1 billion of federal investment over 5 years, starting with just over $213 million in year one. And these funds have been approved by the U.S. Centers for Medicare and Medicaid Services. This program will support more than 400 rural healthcare facilities, and we really see that this investment will not only help to advance care in our rural communities, but it will do so by working collaboratively, which is why we are excited to introduce the Roots Hubs. But we'll be working collaboratively as a program across state agencies, healthcare providers, academic institutions, community-based organizations, and the private sector. So this really is a program that's meant to work together. And so we need all of you who are on this call to do this with and to move forward. So if you move to the next slide, rural health transformation is built around 6 integrated initiatives. And you can see each of those initiatives on this slide. And I know that there's a lot of words here, but we hope you can take this back and continue to use it for your own purposes. But you can see this is expanded primary care and chronic disease management to workforce development and behavioral health expansion, as well as expanding digital solutions and financial sustainability. So these initiatives work closely together to advance community-led solutions. And the Roots Hubs themselves are critical to making that happen. They serve as the regional connectors that bring these initiatives together and bring this work to life. And I did just want to note, because I know we've gotten some questions on this, that initiatives 1, 2, 4, and 5 are implemented directly through the Roots Hubs. So that's that's prevention and chronic disease management, workforce development, and financial sustainability implemented directly through the Roots Hubs. Whereas hubs will ensure the coordination of programs related to initiatives 3 and initiative 6, but those are implemented separately. So just wanting to note that. So I want to transition just a little bit to the next slide to talk about what has been accomplished over the last couple months and where we are going. So over the next year, it's my team's priority to demonstrate effective, efficient investment of these dollars and to show impact in real ways in rural communities. And so I'm excited about what we get to announce today. So we're obviously, we've awarded the 5 Roots Hubs across the 6 Medicaid regions, serving all 100 counties. We'll dig into that more. But we also have late breaking news. This was just announced today, but we have launched a partnership with the North Carolina Department of Information Technology. So through NCDIT, we are funding the Health Information Exchange, which is a data exchange, which will help onboard rural providers and train them on how to use the data exchange. And we believe that this program will onboard over 400 eligible rural providers. Additionally, through DIT, we are also partnering to expand patient access to digital skills training and digital health literacy training. So coming in July, anyone can call into United Way's NC211 service and ask for a digital health navigator, and they can be trained on how to do telehealth, how to connect to a patient portal, and how to connect with their doctor's office in a virtual manner. So again, this is that encompassing of providing technology to providers, but also ensuring that patients have the training that they need in order to connect virtually. And then finally, we just announced $10 million of awards to 39 EMS agencies to expand and strengthen mental health crisis response and improve treatment access for substance use disorders. So this is going to increase the capacity of emergency services across 39 counties in North Carolina. So we've done a lot in a short period of time. We do have a lot more to do. So if you go to the next slide, you can see what we plan for June and July. We'll be doing a lot of onboarding for our Roots Hubs. That's what we are actively doing right now. And the Roots Hubs will begin to complete their regional needs assessments. They have 60 days to do that. We'll also be launching a Rural Health Transformation Advisory Committee, and I'm excited that we've just announced the release of an expanded North Carolina Minority Diabetes Prevention Program. So you can look at that on our website. This is specifically for targeted counties in Eastern North Carolina, but it's a really exciting program. And then as an office, we're going to be continuing to recruit and fill for positions so that we can make sure that we are effectively and efficiently getting funds out the door to make real impact in rural communities. So if you know good people, please send them our way. And then if you look at the next several months moving into the fall, our hub leads will complete their action plans. We will be launching a Rural Health Innovation Fund that will allow providers to apply to receive funding to purchase needed technologies, and we'll begin some behavioral health programming. And then later into the fall, we'll really see our Roots Hubs community programming launch and funds getting out the door in those rural communities, and then some expansion of some workforce and mental health programming. So we've got a lot to do over the next 6 months. We will make sure that we are communicating regularly with the public, and we will also be updating our website regularly. But I want to get us to what the whole exciting part of today is, and that is to introduce the Roots Hubs. So just a quick background on what are the Roots Hubs and what's the Roots Hub lead. So as a reminder, the Roots Hub is that Initiative 1. It's the linchpin of rural health transformation for North Carolina. And these are locally governed networks of community stakeholders that implement the rural health transformation initiatives. And the Hub lead is the organization that's responsible for coordinating and guiding a regional network of partners to improve health services in their region, right? As the secretary mentioned, we wanted there to be regional ownership over this work. So you can see there on that graphic that you have the Roots Hub lead. They're setting up a governance structure with partners in their regions. You can see examples of those partners, though this is not a full list of partners that would be involved. And then once they have developed their needs assessment, their action plans, and have their governance structure set up, that's when they can start awarding subgrants and contracts to meet needs in their region. If you go to the next slide, you'll see a map of our hub leads and which regions they're serving. You'll hear from each of them. And then finally, we know there's been a lot of questions about how to connect with the Roots Hub. And if you go to the next slide, you'll see that on our website, we have a pretty easy way for you to learn more about each Roots Hub and how to contact with them directly. I'm going to pause there because I think I've reached my time allotment and I want to make sure we have enough time for the Roots Hubs. And so the way this is going to work is each Roots Hub is going to introduce themselves. They'll have about 5 minutes to introduce themselves and talk about the work that they're doing in their communities. If we start to run out of time, I'll be timekeeper and move us along, but then they will pass to the next Root Hub, and you'll have a chance to hear from the 5 hubs serving the 6 regions. So without further ado, I will pass it to Impact Health and Region 1 to introduce themselves.
Hi, good afternoon. My name is Lori Stradley, and I have the privilege of serving as the CEO at Impact Health based in Asheville and serving the 19 westernmost counties of North Carolina. If you could show the next slide. We came into being for just this kind of work. Our mission is to lead innovative strategies that bridge community and clinical systems of care to ensure that all Western North Carolinians can access the resources they need to thrive. Our goal is to live in a region where we are a model for thriving, fully engaged communities where all people live healthy lives. And we're excited to join you and be a part of rural health transformation. If you can go to the next slide. We represent a region that has been a part of this work in many cases for generations. And so what Impact Health brings is our ability to connect. You can see the image here of the swirling circles. There is nothing that can happen all by itself. We've had the opportunity to serve as health-related social need or non-medical driver health or social health, whatever you want to call it, about a part of the innovative work of Healthy Opportunities And we've carried that through in all areas of our work. We launched the Impact Primary Care Network just a little over a year ago to continue this work to bring our social care, whole person healthcare closer together and make sure that our clinicians have what they need to better meet the patient's needs overall. We are community centered. We are rooted here in Asheville, but have staff across the region. And it's always our goal to make sure that we are deeply embedded in our community, always in listening mode and ready to draw together our leaders from around the region into the state and national conversation. And finally, we try to do that work. We believe that all of the learning we've had the opportunity to do out here should be shared. So our goal is to host, to train, to teach, to make sure that others are able to make this happen in their own regions. If you can go to the next slide. I always have to share a little bit of information about Healthy Opportunities. We are so proud to have been a part of the beginning of that. Hope to get to continue that soon. We connected with over 60 organizations across our region, serving nearly 14,000 individuals and countless more families. Over 400,000 services were provided through the engagement of those organizations, and over 450 farms in our area were able to provide local food into this program. It's not just specific health and health outcomes that we do together, both in Healthy Opportunities and in rural health transformation. It's about creating a thriving economy where everyone can access great work, great benefits, and great resources. Just through Healthy Opportunities, we provided, and not through direct funding, but through indirect supports, 1,111 full-time jobs, generating over 138 million in total business activity. If I can go to the next slide, you'll hear this repeated by my colleagues across the state, and you've already heard it a little bit from Maggie, that we are extremely focused on listening, connecting to the region, not just assessing our needs, but cataloging our assets. We know that Impact Health's role is not to be the expert and to lead the change, but to invest in all of our partners, colleagues, experts across the region who already know how to do this, ultimately coming together on an action plan that will guide this work for the next 4 years. And if we can go to that the next to last slide. Our focus is to strengthen, expand, and sustain. There is so much good work happening here already. We don't see a need to innovate new processes or new programs, rather to innovate the ways that they are connected, sustained, and engaged in the work we do together. And lastly, one of the areas that we believe will help us do that, on the last slide I have, one of my slides seems, there it is, thank you, is to build a stronger data exchange. We have a lot of great technology and communication happening already, but it's too often happening in silos. And for the benefit of the individual who should have access to whole person care, we need to make sure that all the folks who are engaged in providing that care have access to real-time data, both on the needs of the individual and on the resources of the community and clinical spaces to get that care more effectively, efficiently, and consistently. And with that, I'm going to wrap up Region 1 and hand things over to my colleagues in Regions 2 and 5 at Trillium.
Thank you so much, Lori. Appreciate you. And all the information you've shared has certainly been super helpful. I'm Cindy Ehlers with Trillium Health Resources. I'm our Chief Strategy and Innovation Officer and the Interim Executive Director for Regions 2 and 5 of the NC Roots Hubs. Trillium was awarded 2 Roots Hubs, and Regions 2, as you see here on the map on the left, and Region 5 on the lower part of the southeastern part of the state. Trillium is also, if you look to the map on the right with the purple, is also a health plan, a tailored health plan, one of our public plans in the state of North Carolina, serving individuals with behavioral health, substance use, IDD, traumatic brain injury, in 46 counties, 42 of which are considered extremely rural counties in our state. And so we are uniquely positioned to work in this NC Roots space. We aren't starting from scratch. We already have the infrastructure, data, community trust across much of the area that we're serving. And we're building new relationships in Region 2 where Trillium does not currently have a footprint. Meeting lots of new people, hearing about the exciting things that are going on from Watauga, Ash, Allegheny, all the way through down to Davidson and Forsyth, areas that we don't currently cover. In addition to that, because we're a health plan, we have the capability not only to pull together complex provider networks, but also create local coalitions, which we have done. Trillium worked with Access East and Community Care of the Lower Cape Fear as they stood up 2 HOP programs in Eastern North Carolina that were, as Lori said, very successful at changing the healthcare along with Impact Health in Western North Carolina. Our core mission as a public health plan has been serving these individuals with some of the most significant needs, and that role remains unchanged while we're embracing this new role, working with the whole population, not just the carve out for behavioral health and IDD, but every person that lives in the rural communities in regions 2 and 5. Our core mission is making sure that people get their needs met at Trillium. And the NC Roots population is no different. The health goals are all something that we can do something about. We can work to find some sustainable, outcome-driven business solutions that outlast this temporary grant funding. Our goal here isn't just to manage this program as a grant, but to leverage our position as a health plan and to turn this state investment into permanent, thriving new reality for North Carolina. Next slide. So I grew up in Eastern North Carolina, spent my whole life here in the rural parts of North Carolina. And in my life, I've spent a fair amount of time in farming, especially in my younger years, working in the summers like right now in tobacco and other crops. And I would just say that, I couldn't help but use this type of graphic to sort of share how we're going to grow NC Roots from this small sprout to a fully rooted, thriving plant. So it's not just a visual metaphor here. It represents exactly how we intend to make this sustainable for a harvest down the road. So first, it's partnership. As a health plan operating in the 46 counties we serve now, just under half of North Carolina, we know the infrastructure doesn't grow in a vacuum. You have to leverage this position to pull together local networks and community leaders. And I would just say for all the community leaders listening or participating in this webinar, the outreach has just been amazing to see the number of people that are emailing or calling or finding a way to get through to us to make sure we know about what they're doing and how they're doing it. It's just amazing to see how many people are showing up already just to get this done for our rural communities is nothing short of amazing. Second, accountability. One of our deepest leadership philosophies is to be accountable for the outcomes for each of these rural communities. As a public system, we invest every dime we have in our stakeholders and making sure that our rural communities that we serve and all the communities Trillium serves and the communities that we will serve in NC Roots get the benefit of every penny of money that we can leverage, not just the Roots money, but other funds that we may be able to bring to the table through philanthropic efforts or other grants to blend and braid funds together to really make this happen and make it sustainable, alongside all our other partners in the Medicaid health plans across North Carolina. Third, we believe in transparency and making sure that you know what we know when we know it, and sharing how we're going to go about doing things in Region 2 and in Region 5. Trillium is going to be hoping to make sure that we answer your questions before you ask them. We are committed to open communication, sharing data, and strategic clarity with all of our state and local partners every step of the way. And finally, investment. This is where roots really take hold in the soul. We aren't just looking at this is a temporary grant funded program that will be here and go away. We are looking at how to turn this state investment through the federal government into a value-based, outcome-driven business solution that outlasts any single funding cycle. So getting grounded in this, I want to just take a real brief second to introduce our stand-up team. Next slide. So as I mentioned, I'm Cindy Ehlers, and I'll be the NC Roots Hub Executive Director for a little while we're recruiting our Executive Director in Region 2 and 5. We'll have a director in both of those. I'm joined by Anthony Ward, who is our Interim Vice President for Region 2, and Haley Sink, who's our Interim Vice President for Region 5, and then Kay Freeman, who is our Interim Director of Community and Tribal Engagement. And then we have a whole host of other folks that are part of our stand-up team. And at this point, I'd like to hand it off to our Interim Vice President of Region 5, Haley Sink. Haley?
Thank you so much, Cindy. Good afternoon, everyone. Thrilled to be with you today. Haley Sink. I serve as Senior Vice President of Strategy and Innovation here at Trillium, and have the privilege of being part of this incredible rural health transformation work with NC Roots. Born and raised in Forsyth County, and actually I'm coming to you today from Wilkes County in Region 2. We're taking one of our innovative technologies statewide to increase employment opportunities for folks with behavioral health needs and disabilities. So really excited to be joining you today. We are going to just briefly go over a few opportunities that are already out and posted as part of our NC Roots work and commitment to both Region 2 and Region 5. And in our first 90 days, these are the key priorities, that listening, that learning, that transparency. As Cindy mentioned, we know that our communities, our neighbors have the answers, right? They've been doing this work for decades. They are the trusted leaders and trusted messengers in their communities. So leveraging that and really making an impact. We're getting to do that through our regional needs assessment, using both the data that we are getting both on the numbers side and the listening sessions, so we can get those stories too. Establishing our board, that is all on our website. You can go to Trillium and search NC Roots, and it'll be on our homepage too. You can apply for those boards and also some funding opportunities. So our commitment was Rule Ready Now, and we intend to carry that forward. So next slide, please. I will quickly chat through these. There's our website, again, Trillium NC Roots, and we have a dedicated website you'll see here. You can click for Region 2 or Region 5. Next slide. These are some letters of interest that we have put out already. Some you could apply for across region, but also, again, it's important that you go to Region 2, Region 5. Those are separate regions, separate communities, separate needs, and apply for the one that you are interested in. So this is our first rollout of funding opportunities and different opportunities to get involved in this work. And then we intend for much more investment and funding opportunities to come in the fall. All right, and moving right along. I think this is our last slide, maybe. There you go. There's a sample of the letter of interest. Most of the current ones are due by June 30th, so here next week. All right, next slide. And this is just ways to stay connected. We're happy to drop this in the chat, or this will be in the slides that are sent out. You can sign up for our engagement list there at the link, the bit.ly link there. You can use the QR code to get to the website. Certainly, we are honored to be part of this work in Region 5 with our Lumbee Tribe of North Carolina, the 575th recognized tribal nation in our country. And so we are doing some great work there. If you have any questions related to the tribe, please reach out to, or tribal engagement, please reach out to Kay Freeman. Her email address is there, and more to come very soon. And at this time, we will wrap it up. Thank you all so much, and hand it off to our wonderful partners in Region 3.
Hey, good afternoon, everyone. My name is Rhonda Cox. I'm the Executive Vice President and Chief Operating Officer for VIA Health, which is a tailored plan that currently covers 32 counties, primarily in Western North Carolina. And then in October, we will be joining forces with partners to cover 47 counties, primarily, again, similar to the Trillium team, which has always been rural counties. I think one of the things we'd want to start with is we were very intentional about, and I'm using the collective we, so somehow we've jumped ahead on a slide and I'm not sure how we did that. Can you go back, please? Thank you. So ViaHealth, App State, which is also has comprised with AppWell and Partners Health Management, we have been here, like Cindy and Laurie mentioned, but many of us have been here in systems and organizations that have lived in Western North Carolina and supported Western North Carolina for decades. And so I think we wanted to make sure, because we have lived experience where there have been many wonderful initiatives that were started and well-intended, and they were not sustainable. And often the impact for many of us were rural counties in particular were left in a worse position than before. So with that in mind, we said, you know what, we believe we can do this. We can make sure the money gets to rural counties, and we believe that we can create a sustainable program. And we had the great privilege of doing that with Region 3, and so grateful to the department for the opportunity to have some additional fundings to launch that. Next slide. Maybe the next slide. Oh, there we go. I may be tech on my side. So you've already heard some of my teammates mentioned, but we believe this. We're a public entity. We believe in leveraging public infrastructure. Again, these are decades-long trusted partnerships across North Carolina. And we wanted to not only focus on the resources of a health plan, which Cindy mentioned, but also leveraging App State, which has been a core educational resource who works closely with public health workforce pathways. They have large-scale evaluation and training capacity, expertise already in play. And then partners like VIA is bringing their LME MCO experience and many long-standing relationships in Region 3, in addition to the counties that we serve. And then also sister agency, I think Trillium has a little bit in there as well. And the opportunity to just partner, I think, across the system, taking what we know and using the local relationships and trust relationships, because if you're from a small town, you know, if you're not from there, people don't immediately trust you. And it takes time to build that. I think it's important for us because we do believe that you have to use what communities have, people that they know, and then strengthen those things in a way that helps build a path for sustainability. Next slide. So we have learned from many years' experience. We don't have any a desire to come in and be the boss of anybody. We want to take the infrastructure that we have. We know that communities already assess what they need and routinely prioritize on cycles. So we will listen, because that is the job, and take the existing information, I think, and that they will provide, and then prioritize and decisions, allowing those communities to drive those decisions process through a transparent and accountable process. I liked what Cindy said about you'll know it when we know it. I think it's also important as decisions are made, regardless of county or political kind of influence, you want to ensure that people know how decisions are made, and how they work together. And then the implementation and ability to measure and sustain programs is the key, because again, if we don't provide the data back to the department and to our communities, then that also means that we potentially put at risk the opportunities for additional funding for the citizens of North Carolina. So we believe that everything should be traceable, that it's validated, that there's a clear plan and a measurable output, as well as always maintaining sustainability as the forefront of our approach. Next slide. Go back one, thank you. So again, how do we fit together? So VIA is leveraging our experience, our infrastructure, our size, and sort of our existing longstanding history with managing large-scale financial implementations, large-scale regional and statewide implementations, contracting, reporting, compliance, and those kinds of things. We are very, very fortunate and appreciative of the strong relationship that we have had with App State, and they already, as I mentioned previously, have a strong presence, both in their own right, but as well with other university institutions across the various regions. They have a strong presence already with workforce, public health, and evaluation. And that learning infrastructure, we will believe, is great not only for the short-term lift, but also for supporting communities in the longer-term lift. And then Partners Health, many of the counties, they have been there for, I think, over 50 years, like us have been around. And again, being able to just leverage existing community relationships. Our staff live and work in these counties and have for many, many years, which helps build that trust. And then again, at the grassroots level, really leveraging our public health anchors, which give us that community insight. They are also many times the driver for the community health assessments and the need for coordination, and they're a trusted partner. And then also creating cross-community regional decision councils so that voices can genuinely be heard. We can use an appropriate and clear process for validating needs and priorities, and then making sure that there are truly transparent local recommendations. And then I think we're on the home stretch. Last slide. So thank you so much. We have information on our website, and are just a few weeks away from sort of a little bit more splashy dip in. I want to tip my hat to the Trillium folks who've done a great job of getting out and getting information as well in it. So we will be seeing you. We've similarly appreciated all the interest that we've experienced from many, many local and state level partnerships, as well as a lot of outreach and community between the respective Roots Hub leads. So we know that humans don't live neatly in a box or in regions. And so again, I think not only the individual region strengths of our respective hub lead participants, but also I think the community and coordination across these respective areas will really help us build a long-term strong program for the citizens of North Carolina. And with that, I will hand it off to Matt Kitzinger from Region 4.
Hey, good afternoon. My name is Matt Kitzinger. I serve as the Executive Director for Rural Health Strategy and Partnerships at UNC Health. On behalf of UNC Health and our partners, Granville Vance Public Health and Piedmont Health Services, I want to thank you for your interest in the RHTP program and the NC Roots Region 4 Hub. Before we begin, I'd like to briefly introduce UNC Health. Many of you are familiar with UNC, but I want to make you more familiar with what this state-owned healthcare system is all about. We're headquartered in Chapel Hill, as you can imagine, but we have a mission to improve the health and well-being of all North Carolinians. Our vision is to reinvent the means to be, what it means to be North Carolina's health system by working alongside communities, providers, public health organizations, and local partners. The mission is exactly what brings us together today. We're honored that UNC Health was selected by the North Carolina Department of Health and Human Services. It's an honor to be selected among the folks who have already presented. And we're honored to be a lead organization for this Region 4 hub. Our region spans 14 counties. Next slide, please. And eastern and central and northern North Carolina. It includes communities that are incredibly diverse, urban, rural, and everything in between. The purpose of this program, as you know, is ambitious to strengthen healthcare access, improve coordination, and support healthier communities across the state, particularly in those that have faced barriers to care. We're especially proud of the work our organization has done to expand across North Carolina, to train physicians and clinicians who remain in the state, and to advance clinical and practical research. This work cannot be accomplished by any single organization, and it requires collaboration, shared leadership, and meaningful community engagement. Next slide, please. One of the strengths that UNC Health brings to the table is that we have an ability to collaborate across organizations, sectors, and obviously, as you can see here, the map. Through UNC Health Alliance, our clinically integrated network, we work with independent physician practices, health systems, community organizations, and public health partners throughout North Carolina. That experience has taught us an important lesson. Sustainable change happens when local expertise and community voices guide that work. Excuse me. This NC Roots initiative builds on that same philosophy. Next slide. That's why we're especially excited about our Tri-Anchor partnership model, as you see here. UNC Health serves as the hub lead, but we're joined by two outstanding anchor partners, Granville Vance Public Health and Piedmont Health Services. Together, we bring complementary strengths to the table. UNC Health provides broad regional healthcare infrastructure and clinical expertise. Granville Vance Public Health brings deep public health leadership and strong connections across local health departments in their region. And Piedmont Health Services contributes decades of experience serving communities through safety net and federally qualified health center networks. Together, we think these partnerships allow us to combine scale with local rootedness, ensuring that every county and community in Region 4 has a voice and a pathway to participate. Next slide. As you see here, this is how we envision our Tri-Anchor partnership to work. Each of us contributing strengths as well as reach into this 14 county region. Next slide. While they're not all on this call to join and share today, I just want to take a moment to recognize the leaders here who have made this possible and who will continue to be incredibly involved in the work that we do together. This work will be not just guided by these leaders, but also by community partners, healthcare providers, local governments, faith-based organizations, social service agencies, and residents throughout the region. Over the coming months, we'll be building advisory councils, work groups, and broader regional networks to help shape priorities and guide implementation. We want this effort to reflect the needs and the strengths of the communities we serve. Much like you've heard from the prior presenters, while our regions all have needs, we also believe they also have strengths to contribute. This work is largely about connecting those strengths, connecting those community organizations to make the most out of this opportunity. Whether you're a healthcare provider, community organization, public health leader, local government representative, advocate, or resident, your perspective matters to us. If you'd like to learn more, as you see below, feel free to connect with us via the email you see, or fill out the organizational interest form that's linked here. We believe this is a once-in-a-generational opportunity to strengthen our rural health. And as a native North Carolinian and Tar Heel, I'm especially proud of our opportunity to serve you all. So with that, I'll close and I'll hand it to our Region 6 partners. Tina?
Hey, I'm Pam Cowan, and I'm going to kick us off and then turn it over to Tina. And I get the pleasure of introducing you to Access East and to also Region 6, and what I like to refer to Region 6 as the state's hidden gem. If you haven't visited Eastern North Carolina, I would certainly encourage you to. It's a wonderful, wonderful place. But saying that, I have to give you just a little bit of background, setting the stage for Region 6, and then you'll understand the work of Access East and why we are so passionate about RHTP and the opportunities. So in Region 6, you're never really alone because there are a lot more hogs than there are people, and they don't have to have access or appointments to healthcare. So keep that in mind. And then also in Eastern North Carolina, your GPS and directions to healthcare may sound something like turn left at the soybean field, drive 20 miles, and you will get there eventually. So keeping all that in mind with how rural we are in Region 6 and how vast of a geography we serve, the programs at Access East are essential, and our partners are essential. So if we can go to the next slide. So Access East, our mission really is to improve health through access to and coordination of quality care in Eastern North Carolina. Access East has been around for a long time. We have over a 30-year history of providing whole person care to folks across rural counties, largely in Region 6, but also touching Region 4 and 5. And importantly, we are a nonprofit 501c3 affiliate of ECU Health, and ECU Health is the largest provider of healthcare in the region. So some of the programs and services that we provide, we do provide Medicaid care management and practice support, which obviously aligns with some of the initiatives you've heard about. We also have a robust Health Assist uninsured network, and this links patients to resources that they may not know about or may not have previously had access to. And this also includes a large farm worker program. Healthy Opportunities Pilot, much like Impact Health, we were a network lead for Healthy Opportunities, and Tina, you'll hear from her, was the leader for that program. ACA Navigators is a program, remote patient monitoring. How else are we going to reach everybody in that rural area? And then nurse triage services. And so that's a 24/7 support. Because we are so vast in Region 6, we need ways to keep up with our patients. And with that, I'm going to turn it over to Tina to dig more into the specifics of how we're approaching RSTP.
Next slide, please. Good afternoon, everyone. And I am Tina Dixon. I'm the Vice President of Rural Health and Social Care Integration. And I will be sharing a little bit more with you about how we're planning to stand up our Roots Hub. I will not delve into the goals and priorities, but I do want to highlight some of the chronic diseases that we will be focusing on, we think, which is diabetes and hypertension. And then for perinatal health, we'll be engaging in, just like the other Roots Hubs, in Locate, I Gave Birth, CHW Doula Model, and in other areas. But I do want to just say out loud that I Gave Birth was born in Eastern North Carolina. Next slide, please. Okay, our key strategies will be much like what we've used in the past, where we leverage existing relationships and knowledge in order to build things. And using that method has allowed us to build things that last. It will be a very engaged, collaborative process with support from local health systems, hospitals, AHECs, community colleges, FQHCs, CHCs, and community members. We actually have 3 Indian tribes and tribal communities in our area. We will be engaged with them. They're the Halawa-Saponi, the Meherrin, and the Chowanuk Nation. So we will be touching those communities as well as our large Latino community and populations in this area, because we have lots of farm industry here. We will be talking to economic development organizations, as well as our philanthropic organizations that support programs and services in the East, as well as community-based organizations and faith-based organizations. We feel like partnering with all of these organizations and individuals will allow us to build something that we can keep for several years and hopefully forever in Eastern North Carolina, because we've had so many experiences where things will come and things will go. And then, as a previous speaker said, then we're worse off than we were before it happened. And we don't want that to happen with RHTP. As far as our structure, we will, of course, be communicating regularly with the stakeholders. Back to that slide. Go back one slide. We will be communicating with our stakeholders regularly. And the stakeholders for us is everybody in the community, everyone who has touched us or we've touched them, because we want to keep everybody involved in this process. We, of course, will have a governance structure where we will have a network council that will meet regularly. But the big star is going to be the steering committee. The steering committee is going to be composed of partners from across Eastern North Carolina. They will be helping us to make decisions. So it will be a completely collaborative, engaged, community-led process. And then we will have initiative work groups that will be focusing on the individual initiatives, and they will be supported by a core team of individuals in the Health Assist office. Next slide, please. This is a graphic of our structure, and you can see that the steering committee is in the middle. And because there's so much work to be done, we've spread it out. So we're using a true traditional hub and spoke model that is collaborative. Next slide. So where we are now is we're working on finalizing all of our contracts. We're working on a communications plan. We're doing all of those setup activities that are required for us to get off to a great start. Our needs assessment is our first huge deliverable, and that will allow us to figure out how and where the gaps are, what's needed, where, and then use the funds that we receive from RHTP in order to support that gap filling and helping us to build something that will last long term. So I'm excited to be going on this adventure with several people in Eastern North Carolina and all of the hub leads and DHHS. And I'll pass it back to Maggie now.
Great. Thank you so much, Tina. And thank you to all of our Roots Hubs. These were great presentations. I know we have a lot of questions, so I want to get to those, as many as we can, in the next 4 minutes. So I'm going to invite my colleague Rachel Cooper and Deputy Secretary Farrington to join me virtually to answer some questions. So Rachel, do you have the first question for us?
I do. Can you hear me okay?
Yes.
All righty. And I may direct some of these questions to Deputy Secretary Farrington as well as you, Maggie. So the first question is, given the significant rural barriers to behavioral health services, how will the NC Roots Hubs strengthen integration of mental health, substance use disorder treatment, developmental disability supports, and NC Innovations waiver services with primary care? So maybe I'll start with Deborah, if that's okay, and then Maggie, can you chime in?
Happy to.
Yes, thank you, Rachel, for that question. Our Roots Hubs will partner with our local management entities' tailored plans who have the primary responsibility for implementing our Initiative 3 activities. You know that Initiative 3 is focused on behavioral health, and the Root Hubs will not lead that work, but they will partner with the LME MCOs to make sure that we implement a standard array of services in every region that are supported by integrated care networks. The initiatives are going to build on the existing work that's happening in behavioral health, but specifically target our efforts in rural community. Integration is going to happen because we're going to focus on expansion of certified community behavioral health clinics. We're also going to make sure that we're addressing enhanced assessments and making sure that the treatment people receive integrates both behavioral health and primary care services. Maggie, is there anything you'd like to add to that?
I think you hit the nail on the head.
Awesome. Okay, so we'll move on to question number 2. And I think this is broader than just the Roots Hubs. Someone is asking, can you talk a bit more about the composition of the Rural Health Advisory Committee?
Yeah, absolutely. So we thought it was really important that we have a committee that helps advise us, that has representatives from across the healthcare spectrum, bringing in rural voices, providers, hospitals, consumer advocates, tribal representatives, as well as community members. And so this will be an array of partners from across the state, including legislators who come together and meet on a quarterly basis to hear a little bit more about where we are and some key decision points for rural health transformation. I'll say that these meetings will be open to the public as well. And so we'll make sure that we are communicating on our website and through our newsletter when those meetings will take place. The first one will take place in August.
Great. Thanks, Maggie. The next question, I think I can also answer. It's, can you tell us where the website materials and slides will be posted? So the slides and a recording of the webinar will be posted to our website on the Rural Health Transformation Program page. We can put a link to that, I think, in the chat shortly, but they will be posted within the next few days. So thanks. We'll move on to the next question.
Maybe one really quick question, Rachel, if possible. Sure. If not, I do think we need to wrap up.
Okay. Question number 4, how will the Roots Hub strengthen services that address maternal health, maternal mental health, and early childhood mental health? And I'll kick that to you, Maggie.
Great. Well, you heard from some of our Roots Hubs on their plans. The Roots Hubs expand access to maternal health in maternity care deserts through required perinatal programming. So, for example, implementing the maternal health focused I Gave Birth initiatives, as well as the community health worker, doula, or group prenatal care model. So there are specific required elements that the Roots Hubs are required to implement as part of their plans. And then there are some elective programs they can choose based on their needs assessment. I just want to stop right here. I'm sorry we didn't have more time for Q&A. We had such great presentations from the Roots Hubs, but just want to thank everyone for joining us today, for staying engaged in this program. We appreciate your time, your energy, and we look forward to staying connected with you. Please stay connected with us. We have a newsletter that you can sign up for on our website. As well as we'll be making sure that any upcoming funding opportunities are available on our website soon. And then we will ensure that we continue to do these town halls and webinars so that you can stay engaged as this program gets launched and we see some strong impact in rural communities. So thank you, everyone, and I hope that you have a great rest of your day. This webinar is concluded.